Lay. Sir. Yeah. Yeah.
Kane is in the building.
Alright, already the show goes on all night. Till the morning we dream.
Vesalius always encouraged his students to check their findings, and even his own findings, so that they could better understand the structure of the human body. In addition to his continual efforts to study anatomy, he also worked on medical remedies and came to such conclusions as treating syphilis with China root. Vesalius believed that the brain and the nervous system are the center of the mind and emotion, in contrast to the common Aristotelian belief that the heart was the center of the body. This was revolutionary at the time, and he was the first person to ever believe this. He claimed that medicine was arranged in three parts: drugs, diet, and the use of hands, mainly suggesting surgery and the knowledge of anatomy and physiology through dissection. Vesalius was a supporter of parallel dissections, in which an animal cadaver and a human cadaver are dissected simultaneously in order to demonstrate the anatomical differences and thus uncover galenic errors. Modern medicine is forever in debt to the efforts put forth by Vesalius and his ethic to provide the most accurate form of the human body. The manner in which Vesalius tended to his work could arguably be thought as the most significant than the work itself. By overthrowing the Galenic tradition and relying on his own observations, Vesalius created a new scientific method. His desire to strive for the truth is most evident through his ability to correct his own claims and to continually reshape his thoughts on the human body. Through his attention to detail, he was also able to provide clear descriptions and unprecedented anatomical drawings that set new standards for future medical books. The influence of Vesalius's plates representing the partial dissections of the human figure posing in a landscape setting is apparent in the anatomical plates prepared by the Baroque painter Pietro da Cortona, who executed anatomical plates with figures in dramatic poses, most with architectural or landscape backdrops. During the 20th century, the American artist Jacob Lawrence created his Vesalius suite based on the anatomical drawings of Andreas Vesalius. Upon studying the optic nerve, Vesalius came to the conclusion that nerves were not hollow, which was also revolutionary. Although Vesalius accepted Galen's inaccurate claim that the liver was the locale of blood production, he would not accept that the vena cava stems from the liver. He also disproved Galen's belief that the liver consisted of 5 lobes and stated that it is, instead, 2 lobes. In De Fabrica, he corrected an earlier claim he made in Tabulae about the right kidney being set higher than the left. Vesalius claimed that the kidneys were not a filter device for the urine to pass through, but rather that the kidneys serve to filter blood as well as the excrement. The excrement then traveled through the uterus to the bladder. He described the omentum and its connections with the stomach, the spleen, and the colon. Gave the first correct views of structure of pylorus. He also observed the small size of the caecal appendix in a man and gave the first good account of the mediastinum pleura. Vesalius admitted that due to the lack of pregnant cadavers, he was unable to come to a significant understanding of the reproductive organs. However, he did not find the uterus had been falsely identified as having 2 distinct sections. Vesalius was one of the first scientists to ever do human dissections. He got most of his cadavers from a graveyard down the street from him. So basically what he was doing was illegal. Through his work with muscles, Vesalius believed that the criterion for muscles was their voluntary motion. On this claim, he deducted that the heart was not a true muscle due to its obvious involuntary nature of its motion. He identified 2 chambers and the two atria. The right atrium was considered a continuation of the inferior and superior venae cavae, and the left atrium was considered a continuation of the pulmonary vein. Interestingly, he also addressed the controversial issue of the heart being the center of the soul. He wished... Hi, I'm Andreas Vesalius. This is experiment log 150. It's December the 5th, year 1550. I'll start with a small incision in the chest cavity. As you can see, that's the liver right there. And as we go farther, I'll make a small incision near the femoral artery in the thigh. As you can see, this patient is starting to bleed. This is completely normal. In my discoveries, I found that even if the patient is dead, the blood will still flow out. End log. Harvey had 7 brothers and 2 sisters, and his father, Thomas Harvey, was a farmer and landowner. Harvey attended the King's School in Canterbury, Kent, from 1588 to 1593, and went on to study arts and medicine at Gonville and Caius College, Cambridge, from 1593 to 1599. He continued his studies at the University of Padua, the leading European medical school at the time. He became a student of the Italian anatomist and surgeon Hieronymus Fabricius, who had a considerable influence on Harvey. It is also likely that Harvey was taught by an Italian philosopher, Cesare Cremonini, a prominent follower of Aristotle. Harvey earned his doctorate from Padua in April 25, 1602, and then returned to England to work as a doctor. In 1604, he married Elizabeth Brown, the daughter of Lancelot Brown, a London physician who served as physician to James I, the King of England and Scotland. Harvey and his wife appear to have been happy together, and Harvey referred to her as "my dear deceased loving wife" in his will. However, they did not have any children. Harvey was a fellow of the Royal College of Physicians of London from 1607 and was active in this society for the remainder of his life. In 1615, he was appointed Lumian Lecturer in Surgery at the Royal College, a post he held until 1656. In 1615, he was appointed Lumian Lecturer in Surgery at the Royal College, a post he held until 1656. In 1609, he was appointed physician of St. Bartholomew's Hospital, a post he held until 1643, when the preliminary authorities in London had him replaced, Harvey being a staunch supporter of the monarchy. He was appointed physician to James I in 1618 and continued as a physician to Charles I upon Charles' ascension to the throne in 1625. Harvey built a considerable practice in this period, tending to many important men, including the author of the philosopher Sir Francis Bacon. In 1625, Harvey led a group of doctors attending James during his last illness and was an important witness in the trial of George Villiers, Duke of Buckingham, who was accused of poisoning the king. Harvey was rewarded by Charles I for his care of James. Charles and Harvey seem to have enjoyed an amicable relationship, Harvey being allowed to experiment on the royal herd of deer and presenting interesting medical cases to the king. Harvey lived during the European witch hunt. He was involved in one of the cases in 1634 and had to examine 4 women accused of witchcraft. At a time when belief in witches was commonplace and to neither existence was heresy, it would have been very easy to interpret any suspicious behavior or mark on the body as a positive evidence of witchcraft. It is much to Harvey's credit that he treated the case with an open mind and was willing to consider. In 1636, Harvey acted as doctor to a diplomatic mission sent to see the Holy Roman Emperor, Ferdinand II. This involved nearly a year of travel around Europe. He met renowned German professor of medicine Caspar Hofmann at Nuremberg and attempted to demonstrate the circulation of blood to him. Harvey also had a wide interest in philosophy, literature, and art. During the diplomatic mission of 1636, he visited Italy to look for paintings for the royal